So again, we titled this one, Baby Steps, Navigating Past the Pandemic. So obviously we have been through this really intense, slightly crazy year that we all had to deal with on different levels. And now we're slowly moving past the pandemic and focus on re-entering society. So we're going to unpack this topic a little bit and really employ more of a healthcare provider lens to this particular session. And our wonderful speaker hardly needs an introduction, as he has been a staple in our community, who's Dana Francis. So Dana is a social worker who works at the University of California in San Francisco and has done a tremendous amount in this community and contributed greatly with many presentations and many workshops. So with this, I would really say hello to Dana and pass this session over to him.
Thanks, Lena. It's a nice introduction. I appreciate it. I just wanted to say a few words before I get started with my comments for today about just being in the hemophilia community as a social worker for almost 33 years. And when I was thinking about what I wanted to say about the pandemic today, our current pandemic, I just wanted to mention to all of you, and I think this will really speak to a few of you at least, that our community went through a pandemic about 40 years ago of HIV and AIDS. It was a global pandemic, just like this one has been, and it hit the hemophilia community very hard. For those of you who may not be real aware of what happened, about half the people with hemophilia in the United States got infected with HIV because of contaminated blood products. And I mention this just because I see a lot of patients at my treatment center in San Francisco, and some of them are older guys and women who got HIV and who are still alive today. And I have talked to some of them about PTSD and just kind of feeling like this is very familiar, what we've just been through, and not nearly as many people got sick and died, thank goodness, in our community. But this is not new either. This is a drill, if you will, that we've been through before. So I just wanted to mention that. We're emerging from COVID. We're being told we can take off our masks. And I want to use that metaphor a little bit just to set the stage about mental health and COVID and why some of these things that we're trying to navigate feel like challenges. One thing I wanted to talk about was just the difference between how we and our families and our friends and our culture sees mental health versus physical health. If you get sick, if you have a cold, if you have pneumonia, if you even have a cancer diagnosis, it's not a shameful thing to ask your friends for help, to have someone go to a doctor with you and take notes, to talk about chemo, to talk about whatever it is that you are facing and what you have to do to try to get better. Mental health is different. I think we're making strides, and I think the hemophilia community particularly is really addressing this issue a lot more directly in the last few years. But there's a long history of stigma attached to mental health and mental illness. And today I'm going to talk about some of the different types of mental health struggles, as we go along here. But it's just important to understand that, we all need to think deeply about why it is that mental health is so hard to discuss. And I think there's a shame related to it. And I think as we go through this session today, some of these issues will come up in greater relief. Another kind of foundation for this conversation, and this is kind of a personal favorite of mine, but and I'm mostly talking to men here, but it does apply to women too, but is just in terms of that stigma and shame, what is underlying that? And one of the things that I think about a lot in my work with men with hemophilia is the way that we're socialized in our culture. And I think this is true in many cultures around the world, but we'll talk about the United States today. We've been taught since we were young boys that we're supposed to be independent, we're supposed to be in charge, we're not supposed to cry, we're not supposed to show our emotions, and we need to be a man up and deal with what's going on in front of you. And where do these messages come from? They come from our dads. Sometimes they come from our moms a little bit, our teachers, our churches, our friends, and just the culture that's around us. And particularly more and more in the hemophilia community, younger people are playing sports now. This is a big feature in sports too, is just, be tough, don't surrender. And to all of that, I say, what the hell? This is, I get it, and I understand why we've been taught these things, but I would argue that it doesn't help us. And again, I'm speaking mostly about men and boys here. One of the things that I have tried to push for in working with guys over the years is to get them to think about something I call having a sense of their fuller humanity. So what do I mean by that? I mean that we don't need to limit ourselves to those very strict ways of being. I would like to say that I think, and I see this with men, think of it as a long continuum. And since we're all humans, male and female, are human beings, we all have parts of the masculine and the feminine in us. I would argue we've been taught to be afraid, men have been taught to be afraid of the feminine side of their nature. But this is why we're taught not to cry. This is why we feel like we better man up and we better act a certain way, or we're going to be punished, we're going to be hurt by someone. And I think there's some evidence that that is what happens. So what I'm arguing for is in terms of asking for help, understanding what's going on in our lives, and not being afraid to get the kind of support that we need to think more broadly about masculinity and femininity, and kind of mush it all together and say we're all human and we all have emotional and physical needs that we need to pay attention to. Okay, so how does all that have to do with, what does it have to do with COVID? I think part of what we're all trying to do here as we emerge from this is think about what we've been through and what we've lost, and maybe even a little bit of what we've gained. And that's something that everybody can think about a bit. I was just talking with Nicole before I came over to this meeting about all the things that we've taken for granted, that COVID has kind of helped us to think about in terms of, John used the theme of hugging people quite a bit in his short presentation before me. We just take it for granted that we can be with our friends and family and show them love and hug them, and we haven't been able to do that. And I just hope we don't forget what we lost in the last year, and that we don't take that for granted going forward. So coming out of COVID, we've got people probably wrestling with a number of different areas of mental health. I'll just list a few of them. Physical and emotional isolation, which has kind of been forced on us by just by all the rules and regulations we've had to live under in the last 16 months. Some people have suffered depression. I'll talk a little bit more about that in a minute. Anxiety, those two are often spoken with in the same sentence. Just our general vulnerability about being unsure about our health and not knowing if we were going to get COVID or if our family members were. And another area that I would like to cover in a minute is the idea of grief and loss, excuse me, which are not only related to death and dying, but to just other losses that we go through. So I'll start with depression. I'm sure many of you are familiar with this topic. I don't know of anyone in my life who hasn't brushed up against it in small and or large ways in their lives. Again, back to the stigma and the shame, we don't talk about it. We don't admit that we have a problem, but we need to really think about the fact that if we're feeling depressed, we don't need to be isolated, and we're not alone in it, because most people experience depression at some point in their lives. There's many different kinds of depression. There's brain chemistry, where some people, it runs in families that there's depression across the generations, and that can be very debilitating sometimes. Sometimes people need medication to help them manage that, which is fine, and that's something your doctor can help you with. There's something called situational depression, which is what people feel when they've lost a job or when someone has passed away. Of course, crossing over to grief too, but just something happens and then you're suffering with sadness and depression for a while, and then at a certain point, maybe after getting some help from friends or family or a therapist, that moves on as well, and you're feeling better. It's more intense for some people than others. Some people can kind of just push it away, and some people can't. Some people can't get up and go to work because they're so depressed. So I would just say, don't ignore it. Don't be ashamed about it, and ask for help. Ask your friends and family for help, and if you need to, talk with your primary care doctor about it, and get a referral to talk with someone if you can. I know there are issues around insurance with getting therapy, and that's a challenge, and that's something maybe your treatment center social worker could also help you with. I also wanted to say about depression that having chronic pain and just having a chronic health issue can be a blueprint for getting depressed as well. And I think that's common sense. I don't know if people put those two things together very often, but if you're in pain all the time, it's hard to concentrate on a whole heck of a lot else besides that. So don't, what am I trying to say? I'll say this a different way. Admit that to yourself, and be okay with it. It's all right that you're feeling depressed, and you probably have a good reason to. Anxiety is an issue that we read a lot more about these days. And again, I'll circle back and say, this is good. I mean, it's really good. And I think that the younger generation is less afraid to admit that they are struggling with some of this stuff, and they're more apt to talk about it. I'll give you an example. And I think I may have mentioned this the last time I talked for NHF, but there's a tennis player, a professional tennis player named Naomi Osaka, and I think it was in early June or maybe May, I can't remember when, but she decided not to play in the French Open tournament because she said she just needed to take a mental health break. And I think the news was saying that she just felt like it was too much stress and pressure for her to go right from the tennis court into the press conference after the game. But the fact was that she framed it in this language of mental health. And she got a lot of flack for it and a lot of pushback and a lot of criticism. And she also, interestingly, got support from Michael Phelps, the Olympic swimmer, who has suffered from depression and has been able to talk about it publicly, from her colleague in tennis, Serena Williams, who she defeated a few years ago in a big match, and Serena came out in support of her. And also some professional football player and I think a baseball player spoke up in her defense, and because they understood, because they're also under a lot of pressure in the work that they do and the career that they have. So it was kind of a breakthrough in a way, publicly, to have someone of that stature speak up and say, I need some help and I need some support and I need to take a break from this, what I'm doing, because it's just too much for me to handle. So I thought that was pretty amazing. Another part of anxiety is what we tell ourselves. I call it kind of the tape loop in our heads, and we all have it. And I don't know if people think of it consciously, or I think some people do. They just, I call it the chatter in our brain. And if you kind of think back over your life, it's been there with us all for a long time. And what it does is it just kind of talks to us all day long about who we are and what we're about and what we're capable of doing. And a lot of it's negative stuff. And it comes from, again, from school, church, family, society, advertising. We're not good enough. We don't really know what we're doing. And sounds easier than it really is, but there's a challenge that we can all take on if we want, to talk back to that chatter and tell it to be quiet, and to tell it that it's not true what it's telling us, and to replace some of that chatter very consciously with some positive affirmations, or to put it in plain English, nice things about yourself that you believe or want to believe about yourself, and keeping those things going every day. You don't have to pick a time to do it, but sometimes first thing in the morning, it's good to just start your day with a few positive affirmations that quiet that negative chatter that's floating around out there. So I'm not saying that all anxiety is in our brains, but a whole lot of it is about what we tell ourselves. And I can't stress enough how important it is to not isolate yourself with those thoughts, and or to go into that place which says there's something wrong with me and I don't know what to do and nobody else feels this way. Because I can guarantee you, as a social worker since 1980, when I got my master's degree, everybody has this going on. We just, we don't tell each other about it, and we really should admit it and help each other with it. And humor helps, but also some, real concrete strategies and ideas are out there, and they're available. Some people go to support groups, some people go to therapy groups, some people see a private therapist. There are ways to get support for this kind of thing that we're all dealing with. Okay, I mentioned a few minutes ago the issue of grief and loss, and I just want to bring it up again and talk about it in broader terms than we usually do. Most people think of grief and loss when somebody dies, and certainly that's exactly what we're experiencing when someone we love passes away. But I would like to suggest that grief and loss apply very much to smaller things, smaller losses, the loss of a job, the loss of one's freedom of movement, like we've had in COVID, where we really were told we needed to stay inside. the loss of visiting our friends, having routines in our life that we're used to, going to events, the rituals of our usual lives like graduations, weddings, funerals, social gatherings, concerts. We've had a huge disruption in our life, and there was nothing, it was nobody's fault. It was nature rearing its head, and we all had to respond to that in a hurry. I'll tell you just a brief, short story. My son lives in New York City, and he's in his 20s, and he is a professional person now and working. And he came home when the pandemic started in March of 2020. He had a ticket to come home for his birthday, just for a few days. And when he got here, he kind of had a meltdown. And I thought, what is going on with this guy? This is not his nature. But after talking with him for a while, I realized that everything he had become familiar with in New York City, that the reason he moved there, he's young, he's working, he's making money, he's out with his friends at night, he's having a good time, he's going to restaurants and enjoying what New York has to offer. And literally overnight, that rug got yanked out from under his feet, back in his bedroom that he grew up in California. And his boss is saying, don't come back to the office in New York. I think it was like withdrawal from a drug, and the drug was a good life in New York. So he kind of talked with his mom and me, and he kind of got his act together over a few days or so. It was kind of interesting to watch. And he found a place to live out here on his own, because he was an adult and didn't want to live at home. And adjusted schedule, and was able to work remotely, and is still working remotely from that job to this day. But it was just interesting to watch him maneuver and negotiate and adapt to his new situation. And it wasn't easy, and we kind of saw a side of him we hadn't seen since he was a little kid. But I was very proud that he kind of figured it out and asked for help and talked to people and was able to move forward. I'm wondering if anyone would like to just jump in and tell a short story about your own experience with the pandemic, and it's something you had to give up. Anybody? Don't be bashful.
You may just unmute yourself and share your experiences from last year.
I'll give you a minute.
I have some comments in the chat here that are actually very fitting to this very moment too, Dana. So
okay.
When he was commenting, you were talking a little bit about grief, and grief not just being associated with the loss of a person, but also a lot of different smaller things. And it was stated in the chat here, it can also apply to the loss of a dream, or the idea of raising a child normally without intense medical needs. Can you speak to that?
Absolutely. I absolutely. And I don't think that situation gets nearly the attention that it deserves for moms and or dads. It's I don't know if this is the right word, but it's almost taboo or unspeakable to admit that that it's a disappointment. There's a sadness, there's a loss, and the dream that you had for your child to do all these things, to do all the things that other kids do and with no limits. Who doesn't have a child and have that dream? And I guess what I'm trying to say here about the grief thing is that grief is a funny thing, not funny, haha, in this way that we feel like we don't have the permission to be honest because someone might judge us for saying so. But I think what people can do in those situations, because it's very real and it's very painful, is to just try to find people. It might even be just one person, or it might be a couple of people in your life, your friends, your family. It depends on where your comfort and your safety zone is. And just either talk with them or them. Is it okay? Could I just unburden myself and share some of this with you about some stuff I've been feeling and thinking about in terms of my kid with a bleeding disorder? And hopefully you've chosen a good, safe person, and they'll say, I'd be happy to listen and talk about it. And don't feel guilty about it. I know moms with kids with hemophilia feel very guilty. I've seen it over and over. And I have seen some dads just kind of say, I wanted him to play for the 49ers, or I'm talking from San Francisco in football. I wanted him to play professional sports, or I wanted him to come out and do X, Y, or Z with me out in the woods, and he might not be able to do that. That's totally grief and loss related. So thank you for bringing that up, and I hope you can find somebody to really talk honestly with about it. Thank you. Anyone else?
Yes, it is another comment in here of just sharing of experiences. Sure. And it was shared that definitely dealt with depression this last year. And yeah, just getting outside and going on walks and bike rides really helped, and really to unlock some of the restrictions will be very helpful too. So really having that physical activity there outside.
Mm-hmm. Thank you for that. And that was, I was going to mention that, and I probably still will, but I'll do it now. As a social worker, I found myself asking my patients last year, are you getting outdoors? And so many of them weren't. And partly that was the meme, that was the message of it. Don't go outside. You only do what you have to. You know, I think nobody really knew what the parameters were, but I think walking in the woods or walking even on the street, as long as you had a mask with you, it was so affirming to get outside and breathe and just not be cooped up in the house and have cabin fever and all that. And I remember walking in the woods here in California, taking hikes, and you know, when people were coming toward you, they'd want a mask, and I would do the same. I had it in my pocket, and when I got past them and it was a safe distance, I took it off because I thought nobody's going to get COVID out here in the woods. But being considerate of others, paying attention to what cues they were giving you, and meeting them there, that's good. But yeah, just getting outdoors is, at any time, but particularly after this last year, is so important and so wonderful, really. So, okay. I'm going to continue looking at the clock. But if people, Lena, it's very helpful to have you help me with the chat, because I'm a little bit slow with all this stuff. So,
I certainly will,
maybe we can do it.
I certainly will.
Okay, thanks. All right. I guess I just said this, but I had written down, how do we reemerge into the world in the post-COVID era? And I said, slowly, considerately, and respectfully. And I think it's really important to let ourselves loose. I'm still wearing a mask in stores when even the cashiers aren't anymore. And I'm not a paranoid person, it's just a habit now. And I just think, well, I guess the considerate part is we all have to go with our comfort level and move back into the life that we had before carefully, and pay attention to what other people are doing, and let people come back in at their pace as well, and not judge them for that. So in terms of just the mental health piece of re-entry into the world, I hope this has come across my remarks. So pay attention to your feelings. If you need emotional support, ask for it. Don't be afraid, don't be embarrassed, don't be ashamed. If you need professional mental health support, talk with your primary care doctor and have them help you find a therapist. I mentioned earlier, your HTC social worker can probably help you figure out how to do that too, and maybe even help you figure out how to pay for it. So those are important ways to connect. I wanted to mention that I've been doing a men's support group since 1989 in the Bay Area. I didn't call it a support group back then because I knew nobody would show up. I mean, we have come a long way in terms of our language around these issues. And of course, when when COVID hit, some of the guys said, we need to go on Zoom to do this. And I was skeptical just because it seemed so artificial. But in fact, we started in June of 2020, and we meet every 2 weeks. And we have more guys attending than I ever had before. And not only do we have more guys, but we have somebody in Illinois, we have someone in Buffalo, New York, we have somebody in South Africa, and somebody in Brazil who join us every other week. So that's been a nice way for some of the guys with hemophilia in my area and even in other parts of the country and the world to have a place where they can plug in if they want to on a regular basis. They can count on it being there, and just a place to go and unload and talk about what's been difficult, what's been challenging, what's been good. There's a lot of laughter at our meetings too, but it's just, again, a way for people to connect and to not be isolated. And I think that's really my main message about emerging from COVID is we were kind of forced to be isolated for a while. And I just want people to think about what that felt like, and that it's not necessary. A lot of people live that way even when there's no pandemic. But I think, again, thinking about John talking about hugging each other, we need each other. I think if we learned anything in this technological age during COVID is that we miss seeing our friends and our family. We miss being in people's presence. We've just started seeing patients in clinic in person again in the last month. And I have to wear a mask, and so do they in the clinic room, but it's 1,000% better than Zoom. And Zoom has its purposes, don't get me wrong, and it will continue to. But boy, is it nice to sit across the table from somebody and talk to them. It's really amazing. So I want to give you just a few ideas about places to go to get emotional support. Friends and family, obviously, your HTC team, your social worker, your nurse, your doctor, depending on your relationship, your primary care physician, your local Hemophilia Foundation chapter. Obviously, NHF has a lot of wonderful programs. We're participating in them today. HFA is another national organization that does a lot of stuff for consumers. I had gone on the Mayo Clinic online just to kind of look at the issues around depression and anxiety, and there's a lot of information that you have to be careful about kind of patient syndrome when you start reading about these symptoms and start thinking they're talking about me, they're talking about me. Be careful with that, but it is a way to get some information. There was a film made last year that was shown at NHF in August called Let's Talk, and it was made by the group Believe Limited, Patrick James Lynch's group, and about 5 patients, I think, were interviewed around their experiences dealing with mental health struggles and depression, and it was very well done. It wasn't depressing to watch it. It was hopeful, but it was very, very well done. And that's something I think you can probably get access to, I don't know if it's on the NHF website or if you could just check with someone at NHF, and I'm sure they could direct you to it. And also, finally, this is a little grim, but the National Suicide Prevention Lifeline, which is a hotline, and I'll just give you the phone number if anybody is able to jot it down. It's 800-273-8255. That's a great resource to have for yourself or for people you love, or even people you don't know who might need it. So, and I wanted to say about that hotline, this is kind of amazing, that in 2022, and I don't have it in front of me, but it's the National Suicide Hotline is going to be, I think it's like 988 or something. It's going to be like a 911 thing. It's going to be very immediate that someone can just push 3 numbers and get through to them. And I think that says a lot about where we're headed in terms of our approach to mental health in our country, that finally we're going to streamline that and make it, legitimize it and make it more, give it more parity to physical health problems. So I see that Kate just put up the link to watch that film, Let's Talk. So that's a great resource for everyone as well. I did see a comment go by about spiritual connectedness and spiritual health, and I didn't talk about that, and I apologize, because I think that's a huge part of this is, and I think that's been hard for people who miss out on activities through their church, temple, mosque, just not being able to have that sense of community and that sense of support. And I hope that people have been able to keep in touch with their fellow congregants and are able to start returning to that wonderful place of connectedness with others. So we've got about 7 minutes to go, and I'm happy to respond to anybody else's comments or questions if you've got them.
Thank you so much, Dana. And thank you also for the wonderful resources that you've given to everyone. So there's a couple of questions that are coming in that I would love to transfer to you. Also, lots of kudos from the community here for your long-term commitment to all of us and all the wonderful guidance you've given us. So big thank you is coming in from many, many people here. So one of the questions that came about earlier on was, do you see shared experiences between the younger inhibitor community and the older inhibitor generation and the older hemo community? So this person's son has actually felt more kinship from the older guys than the peers of his own age because of his inhibitor experience. So they're really trying to find the tribe, if you want to say so.
Yeah. Yes. My first impression about that question or comment is this, and it's just kind of a sad truth of our culture. I'm going to go back to male socialization and say that it's more likely that older guys with inhibitors who have been through hell and back with their physical pain and their bleeding and their not being able to get the relief from product that their peers did who didn't have inhibitors. They've been through the wars, they've lived through a lot of difficult times, and they have, not every one of them, I'm sure, but most of them have wisdom and compassion from what they've endured, and they see young guys coming up and they see them, you know, struggling with not being able to access the products. And I know it's getting better with Libra and different things, but I think younger guys are less likely to bond together around their difficulties just because of the stuff I was talking about earlier in the hour about just feeling like you have to be tough and you can't admit that you're vulnerable or scared or hurting or whatever. And I think sometimes there's a nice interplay between the older guys who lived it and been through it, and they understand, and they're not afraid to talk about it, and they're willing to say, you know, tell me what it's like for you, and I'll tell you where I've been, and we can talk about ways to go forward. So that's just my thoughts about that.
Yeah, great. Thank you so much. So another question from our community here is that we have been seeing mental health issues with the younger population increase, and that might have not been so prevalent in the older generations like our grandparents and so forth. So do you think that social media and other platforms are adding fuel to the fire, and what can we do to help teens?
I'm going to be answering this just based on what I've heard and read and not my own experience, but I'll give you a specific example. I've heard that social media has been brutal for teenage girls, that it's a way to beat people up without touching them, to beat them up psychologically, and to try to destroy people's reputation and really hurt people. And I just use that example to say, I think social media can be great for people of all ages to connect with one another, and I also think it can be really destructive. And our kids, mine are a little bit older, but my kids basically grew up with this model too. Our grandparents and our parents, believe me, they had emotional and psychological challenges, and nobody talked about it, with rare exception. And that's part of the perception difference in the generations, is that, you know, maybe it was just not so difficult before. It was, but there was not permission to talk about it, nor was there any emotional safety or any safe places to go. But I don't think that the social media is a really safe place to go either. What we need to do is really check in with our kids, ask them questions, tell them, acknowledge that it's difficult to talk about this stuff sometimes, but that it really helps to get it out, and to encourage them to do things directly with other people, to do events, to do activities, to get outside, to get away from the screen. It almost sounds radical anymore to be saying that stuff, but there's so much, you know, to be gained by even getting together with your friends and taking a hike in the woods and looking at what's there. Sounds silly. I'm sure teenagers are laughing at me if they're on this call. But yeah, we need to encourage kids to talk about what's going on in their life, and to help them find ways to feel good about themselves, and, you know, take life seriously, but not get caught up in all the baloney that's online.
Yeah, no, those are very good points. So I want to ask you one last question. I know we are coming up on time here, but you know me, I'm always trying to be optimistic and trying to find something beautiful that comes out of even the worst situation. So what, if you had to name one thing, what would be the collateral beauty of the pandemic? What would be something beautiful that came out of the pandemic if you had to name one?
I've mentioned John twice already, and I don't know him. I think I've seen him at an NHF meeting back in the day when we could actually see people in person. But I think the collateral beauty, Lena, is recognizing what we've taken for granted and try not to take it for granted. So hugging our friends, being at a meeting where we see people that we know and love professionally, personally, and being able to let them know that. Recognizing what we've taken for granted, and really, really, really trying to make a commitment to ourselves to not fall back into that, but to really appreciate what we didn't have for a while, and to see how fleeting it can be. So that's what I think.
Thank you, Dana. And with this, I'm honestly sending each and every one of you and everyone out there a humongous, big virtual hug. as we are re-entering into our society. So Dana, thank you again for this wonderful session, all of your insights, and all of these great tips and resources as we're moving forward to our new normal, whatever that new normal will look like, and finding our collateral beauty from it.